Today, Dr. Bridget Walker and I will be discussing the recent findings of a major U.S. task force on child and adolescent mental health in 2022. The task force has for the first time ever issued a recommendation that all children between the ages of 8 and 18 be screened for anxiety disorders. Are pediatricians prepared for this level of screening for every child in the country?
Well, it's a really good question, Lynn. In fact, 2 days after that task force issued its recommendation, I received a long email from a pediatrician with whose practice I work, asking me, what measures do we use? We're not trained in this. We're seeing much more anxiety than strep throat. And so what I'm going to do with that group of pediatricians, and I think there's maybe 50 pediatricians, is I'm going to create a curriculum to kind of walk them through the different disorders. There's many types of anxiety disorders, and they all each have unique characteristics. And I'm going to offer services of consultation for them. And basically what they're feeling is that they aren't trained to deal with this, but they need to get training. So that's what I'm doing. I don't know how realistic it is for pediatricians to do postgraduate work at this point in their careers, but a little education can go a long way, and so we're going to see how that goes. Yeah.
What should a parent do if their pediatrician shares the same thing that this group shared with you, that they don't feel equipped, that they're not ready or willing to make those sort of soft diagnoses? As a parent, what are my options at that point?
Well, really today, medical and mental health services are very much consumer driven, and the consumer really needs to become educated to make good decisions for themselves, so a parent can get educated. That's a tough situation. I would imagine that most pediatricians, given this recommendation, are going to realize that they must develop some level of competency in making recommendations to parents of anxious kids. I expect that will be required.
So what you might be recommending is looking for an alternative in my current pediatrician, or the current pediatrician that you're using. Perhaps look for someone who has a more updated skill set, or take the learning upon yourself as a parent and then start to look for someone who might be a mental health clinician in your area to help if you start to determine that perhaps there is an underlying anxiety disorder.
Yes, and there are many websites that are among the resources that I share with you on my websites that have find a therapist services. On my general website, I recall that I wrote up a kind of questions to ask a prospective clinician to know that he or she is trained to kind of deal with the issues that your child is facing. So there's a lot of different things that you can do, but it is really tough to find clinicians with time right now. But you can do it. You can, if you're persistent, you can do it. You can find people.
And what if out in our viewing audience, there are pediatricians who are anxious to upgrade their skills, to learn the modalities and the protocols that you're talking about, and to really understand the questions or the triggers that they should be looking for? How do pediatricians get themselves educated?
Well, that's a really good question. I would like to put out a series of educational webinars to them, and I'm not sure what else will be developed in the field, but I can do my part with that.
So you'll be offering a series of webinars helping these pediatricians get up to speed on the type of questions and what they should be looking for.
Yes, and I'll be very curious to hear the questions they have for me. Pediatricians are on the front lines. I mean, every time you go for your child visit of every age, they're going to pick up on this. So now they're going to know, okay, this is more than just a passing phase. Maybe we should keep an eye on it, see what happens, follow it more closely, decide when to get help. I think guidance from someone such as myself will help them make better decisions so your kids can get the help that they really need.
So Dr. Walker, for pediatricians, parents, teachers, anyone who's engaged in this topic, where can they go to sign up to get alerts when these webinars are ready?
Right, I recommend that they register on my websites, childanxietyscreening.com and drbridgetwalker.com.
And both of these links will be posted at the end of the video for you to capture. Thank you so much.
It's my pleasure.